The broadcast is now starting. All attendees are in listen-only mode.
Hello. Welcome to Especially for Nutritionists and Herbalists number 1. I'll explain the number 1 in a minute as we go along. Welcome. I am so glad you are here. Even though we are only going to be together for about 30 minutes tonight, I promise to make this time well invested. There are several challenges that are common to nutritionists and herbalists, especially those who are just starting out and who don't own or work in health food stores. The first challenge we typically have is we have lengthy intake forms. And you know what, your clients hate them. If you're using an intake form, and I've heard of intake forms being 2 or 3 or 20 pages long, your clients really don't like them. They won't tell you that, but they've told me that when I've interviewed them. They hate these long intake forms. They feel like we as practitioners don't read them, and so they've really wasted their time filling them out. So that's one of the first challenges that we often face, and you might be facing right now. You might feel challenged when you're doing a consultation by not knowing exactly where to start with your recommendations or how to set priorities. What is the first thing you should work on? What is the second thing? What is the third thing? And that leads to a problem for us, which is our third challenge. It means that you probably spent extra time, your own time, doing lots of extra research and crafting beautiful programs for your clients, but you're not getting paid for that time. I've spoken with a lot of nutritionists and herbalists who spend an extra 2 to 4 hours per client session doing research and creating eating plans and food lists and supplement recommendations for clients. And if you're only charging $60 per hour for that hour that you spend with them, and you're spending another 4 hours of your own time, your income just fell to $12 an hour. The last challenge that we face, and that you might be facing, is that because you may be spending a lot of time doing extra research, when you meet with your session again, you might be giving them everything you've got. And so you've spent all that extra time creating all of this info just for that one person. You give it to them, and after the second session, they've decided they are either so overwhelmed with everything that you've created for them that they just can't possibly do it, or you've taught them everything they need to know, so what do they need you for now? And they don't come back. Can you relate to any of these challenges? Have you experienced any of these in your own practice? Well, I know about these challenges because I've been there myself, and I've interviewed a lot of holistic practitioners who've told me they've been there too. We've all been there. We've all done that, but we don't need to be there anymore. So who am I, and what qualifies me to share this amazing information with you that I've got for you? Well, my name is Judith Cobb. I left that off this slide. I've been a holistic health coach since 1981. I'm a master herbalist, a holistic nutritionist, nutritional consultant practitioner, and a certified iridologist. I have been a teacher of wellness professionals since 1985. You can do the math and kind of guess at how old I might actually be. I actually started in the business when I was 6. No, just kidding. But I've been in it for a long time. I'm the wife of 1, the mom of 7, and the grandma of 7. I'm very happy for all of those people in my life, and they are a large part of why I had to figure out what I'm going to share with you tonight. So tonight I'm not going to try to sell you anything. I'm not selling you a course. I'm not selling you a machine. I'm not selling you anything. So I want you to put your wallet away. I want you to breathe a sigh of relief to know there's no pressure to make a fast decision. I simply want to share with you what I hope will be a new way of doing things. I'm going to show you an easy way. Okay, it's not a new piece of technology to buy, just a new way of doing things, an easy way to eliminate intake forms except for your release form or your waiver form that you should be using, you know, where they sign and say they know you're not a doctor unless you really are, that kind of stuff. I am going to also show you how to start creating meaningful rapport from the moment you start the consultation. You know, it's a little hard to do that when you have your head down reading that client's intake questionnaire, isn't it? You're not looking them in the eye. How do you create rapport? I'm also going to show you that you can learn how to do a core assessment in less than 5 minutes in such a way that you will know the right questions to ask. It will help you to prioritize your client's needs, and it will help you to create an order of operations lists for future consultations so that you can work on your consultations in that time slot that you're with your client rather than on your own time. Having an order of operations list is so important because it also helps you to overcome that desire, that burning desire that all of us have to try to fix all of your clients' problems in 1 hour or less. I've learned one of the worst things we as practitioners do is we fire hose our clients with everything they could possibly need to know in the first 1 or 2 appointments. And then, as I mentioned earlier, they either don't need to come back, and that's not good for your business because repeat business is a good way to earn an income, or they feel too overwhelmed to come back, and that is not good for their health. Does this sound too good to be true? I'm going to demonstrate how easy this is because you can literally gather a base of information, then let that information teach you what questions to ask. The assessment becomes a part of the rapport building intake conversation that doesn't waste your client's time filling out 2 or 3 or 20 pages of intake. You get the info you need to make effective recommendations. Your clients don't have to waste their time, and they feel like they've been heard because of the process I'm going to teach you tonight. So the demo I'm going to do is going to take longer than the 5 minutes that it will take you in actual life when you know how to do this, because I'm going to explain my thought processes. Are you ready for this? I hope you're excited for this because this is really good stuff. So when you're starting a conversation, most of us start it for that consultation by gathering basic facts, and this does need to happen somewhere in the consult. But I'm suggesting that knowing their age, their height, their weight may not be the very first thing you need to know from them. The very first thing you need to know from them is what are their concerns and why do they have those concerns. When you start with what are your concerns and then start asking questions about when did they start, how are they impacting this person's life, what other information can they share about it, and they can dump all of that in that first 5 minutes, they instantly start feeling like they've been heard. Most of you have seen the stats that a doctor spends less than 5 minutes with a patient, and typically most doctors know within the first 17 to 35 seconds what they're going to recommend to that client. You can't even say, I've got a bad cold and I'm having problems breathing in 17 seconds practically. So when you've given your clients the opportunity to voice their concern right out of the starting block and you've asked questions about it and you've gotten to know their problem at least on a first name basis, you've already started building rapport. So you'll want to hear those concerns, and then you're going to want to move on to any medical diagnoses that they're bringing in. Has the doctor said what they've got, given it a name? And you want to know what the doctor has called it, and you want to make a note that the doctor said this is what they're calling it. This is to protect you, and it's to show anyone who might want to look at your records at some point in time that you are not playing doctor. This person has a doctor, the doctor said XYZ, and now you're just going to work with nutritional and supplement recommendations. You're not naming a disease. You also want to follow the same concept, the same steps with a prescription. You need to know if they're taking prescriptions, why they're taking prescriptions, what they know about those prescriptions, and you want to write those all down with the dosages, again, to prove that you're not the doctor and that you are doing your due diligence to protect your client as well. You can incorporate the height, age, weight information anywhere into the hour or so that you're going to spend with your client. But then what? What comes after you've let them dump their problems on your doorstep and you've given them you've found out what their medical diagnosis and their prescriptions are, you know how old they are, how tall they are, how much they weigh, then what? Well, then you're going to need to buy about $25 worth of equipment. I hope that doesn't break the bank. It's equipment that you can buy at Target or Walmart or a stamp collecting shop. Seriously, the only high-tech thing you need to know about this is how to change the battery. All you really need to do, what I'm going to teach you next, is a magnifying glass and a pen light. And sometimes you can get these really cool ones that are a magnifying glass with a light built in. Now, we're going to learn a little bit of iridology tonight. And some of you might be going, oh, no, not iridology. I'm just asking, stay with me for the next 18 minutes. Small investment for you to see what this is capable of, and I promise you're going to love it. You've probably heard of iridology. You may even have studied iridology. You may have been thinking about studying iridology, and the thing that's holding you back is everyone is telling you you need a big, fancy, super expensive, high-tech digital camera. And I will tell you, yes, I've got one. I've had one for many, many years. Well, I had a film camera before I got my digital one, and I do use it for every client, and I do love it, but that is not where I started. As a matter of fact, that's not where any of us have started. I have got so many sets of magnifying lights and pen lights and magnified lights in my drawer from the many years that I did iridology with just handheld equipment, low-tech stuff, and this is what I travel with if I'm going out of town. I'm not going to pack up my camera and take it with me. You must be crazy, right? Especially if I'm flying. That's my carry-on luggage, for Pete's sake. I want my luggage for me, not for equipment. So this is what I travel with because I can do just as good iridology with this as I can with my camera. In some ways, the camera has an advantage or two, but you don't need it. So I want you just, if you're brand new to this, to consider, just go to Walmart, get this kind of equipment, and you can start playing with iridology. So what can you do with this? Well, you can look into someone's eyes and read them like a book, almost. Here's just one beautiful thing about iridology, and there are many. Iridology is not a diagnostic tool. It is an assessment tool. When you do iridology correctly, you will never get into trouble for diagnosing, which is naming a disease, or prescribing, that would be naming a cure. But you will have so many critical insights into how a person is put together and where their genetic strengths and weaknesses are that you will be able to lead people to better health. The irides, you may not have known this, but irides, I-R-I-D-E-S, is the correct plural version for the iris when we're talking about the iris of the eye. So the irides are genetic indicators. That doesn't mean they can't change, only that it takes a lot of work to create enough change in the body for it to be reflected in the genes of the body and then to show up in the irides. So again, the eyes give us gifts of information, but they do not give us disease names. They give us information that leads us to the next question, and to the next question, and to the next question. And of course, each question has a valuable answer. Learning iridology will hone your listening skills. I use iridology to understand the genetic strengths and weaknesses of the person and to create a long-term approach in what to recommend for food, herbs, and supplements for their long-term wellness. I use this to create the foundation. I use my understanding of symptoms and how the body works to add a layer of wellness recommendations if they are needed to help current symptoms. So whether your specialty is nutrition or whether it's herbology, you can use iridology exactly the same way. You can use iridology to lay that foundation of what should this person's eating program be for the next many years. And you can use it also, what would be the best core supplements, what would be a couple of herbs that would be so helpful to this person that they could take them every day as a superfood and see nothing but benefit for it. So it doesn't matter. And if you can do iridology or herbology and nutrition, then you can do both. So I'd like to do a case study with you. Now this is going to take us, again, more than the 5 minutes that it would normally take if I was sitting here face to face with the client. Remember, I'm only going to look in their eyes for a few minutes out of that whole hour that I'm with them. 5 minutes max in little teeny spurts. So here we have the irides of a female who is 29 years old and weighs 136 pounds. So that's just the context. Her main concerns: she has extremely dry lips, she has patches of dry skin on the backs of her arms, she has acne, she's very tired, she has night sweats, and she's very emotional. Her doctor has prescribed retinol A for her acne. Now that's going to be important, and I hope to remember to pull that back in later on. And he's also made a diagnosis that her thyroid is low normal, and he has not given her a prescription for it. So we need to know all of that, not because we want to necessarily use the doctor's diagnosis, but because we need to know as a nutritionist how to balance the foods to support the client with those medications, or how to use herbs to support the client with those medications, right? So it's never about us replacing the doctor, it's always about us working to create a better balance. So we've gathered that first little bit of information in our first hi, hello, how are you? And then I would pick up my pen light and my magnifying glass, and I would ask permission to look at her left eye first for a minute. We always start with the left, it's just what we do. And then I'd look at her right eye. Now this is very up close and personal, so you have your hands on her face holding your pen light, and you're holding your pen light and your magnifying glass. So remember, this is as if we're looking at her, so her nose is right here. That makes this her left eye, and this is her right eye. I make a note of what jumps out at me very, very first. Now for me, whatever jumps out first is usually the thing that I'm going to start working with first. It's where I'm going to start asking my questions. And the very first thing that I look at and see here is actually this concentration of this rust color in the middle, hugging her pupil all the way around. Now, this is called a central heterochromia, which just means she's got a different color in the middle of her eye. So hetero means different, chromia is color, central means it's focused around the center of the eye. So because we know that this is all sitting in the digestive zone, I am going to ask her questions about her digestive system, because this color tells me her digestion doesn't do a good job. So the first thing that jumps out at me is the strong concentration of color hugging the pupil, and again that tells me her digestion is weak. And I'm not going to say that to her though, right? She's not going to hear that thought process. I am thinking that if I say it's weak, I've just haven't really made a diagnosis, but I haven't given her a warm fuzzy feeling either. I want to leave her on a positive with this stuff. When we see that concentration of that rust color towards the center hugging the pupil, it tells me that the liver is probably causing stress for the digestive system. Remember that retinol A? Now the retinol A will not be causing this rust color, but if we know the rust color comes from the liver having an attitude problem, and now we're putting retinol A in on top of everything, that's going to be an extra stress for the liver that is already cranky. So as I'm looking at her eye and I'm seeing this color concentrated around the pupil, I'm going to ask deeper and deeper questions about her digestion. Does she burp? Does she belch? Does she bloat? Does she have a lot of flatulence? I may even ask her, what is the flatulence like? Is it painfully distended? Do you pass gas as you need to? What is the odor like? Does it come out in little puts or is it great big puffs of air? Because those things all tell me more about what I need to be supporting. I will ask about a history of anemia because if she's not digesting well, she's probably not pulling key nutrients out, including her iron. And if her liver is angry, she may not be storing iron properly. I'm also going to ask about her energy cycles over a 24-hour period of time because the liver has an awful lot to do with how to balance glycogen and blood sugars. Okay, so do you see how knowing what this means right in here, and I haven't even got nitpicky and specific yet, I already know all these questions, and if my client answers all these questions, and she will, I then have a really good picture painted of what is her stomach, what are her small intestines and large intestines doing, and how is the liver impacting everything. And then the next thing that catches my attention is this brown blob right here because it's kind of stuck out in the middle of nowhere. This is what we call a topostable pigment. And I'm sorry, I meant this one because I'm in her right iris, aren't I? I said right iris here, right iris, there we go. And so topostable means it's the color of the pigment, in this case dark brown, is sitting in a mapped area of the body that correlates to the organ that is represented by dark brown. So we know dark brown is liver, or brown and rust are liver. This is the liver gallbladder zone sitting right in here. So I'm absolutely going to ask her about her liver and gallbladder. I'm going to ask her about her ability to digest fats. I'm also probably, depending on how this rapport is going, by now it's usually pretty good because she's told me about her gas already, right? That's usually you don't talk about personal gas unless you're feeling okay with this person. So I'm probably going to ask her about her emotions because we know that the gallbladder emotionally is where we store anger, bitterness, and resentment. And if it's not resolved, it's going to cause gallbladder problems. So what comes first here, the genetic weakness or the emotion? I don't know. But perhaps if it was genetic weakness, maybe as we support that with the right kind of foods and the right kind of supplements, maybe we can strengthen it. And if she's holding on to anger, bitterness, and resentment, maybe building the liver and the gallbladder will help her to let go of those things, because really, who needs the weight of carrying those kinds of emotions around? The next thing I'm going to look at is these wrinkles in her irides. See these wrinkles? Yeah, most of us have them. This is a beautiful set of wrinkles though, and I mean she's only 29, she shouldn't have wrinkles anywhere yet, she really shouldn't. We call these contraction furrows. When we see contraction furrows, we want to know how resilient is she under pressure, how does she handle stress? We want to know about her sleep patterns. We want to know how well she sleeps. We want to ask about her mood in general. And I'm going to do that because if she's saying that her mood's, gee, she just can't shake this bad mood, or she's always depressed, or she's really short-fused, I can easily put that together with the liver situation. Remember the anger, bitterness, resentment from the gallbladder, and we've got some spilling down into a liver point here as well. And I can go, well, maybe if we would support her nervous system and her liver, maybe she could get rid of this really bad case of UMS she's got. UMS is what I do short for ugly mood syndrome. You know, some people just always have a chip on their shoulders. Is that a term they even use anymore? It's a term that I still use because I grew up with it. And if the liver is out of whack, and if we've got a lot of these contraction throws happening, the likelihood of this person having a perpetual chip on her shoulder is very significant. But we can work that through. There are things we can do about it. The next thing we want to look at here is these orangish dots coming around like this. And it smudges up here. We've got the same kind of stuff happening in this right eye where we've got the dots and we've got, you know, some of it kind of smudgy and bleeding around up here. This is sitting in the lymphatic system, in the lymphatic zone. So we call these blobs tophi, T-O-P-H-I, and they suggest that her lymphatic system is not good at flushing itself. Now, you already know that if the lymphatic system is sluggish, the immune response will always be poor. The person will always be prone to either frequent infections or they'll just never feel completely well. Kind of like she's always trying to come down with something or she's always on the verge of a cold. So I want to know about her immune function. Does she feel like she's always got a cold? Does she feel like she's always getting a cold? Does she catch every flu that blows past whether she needs to or not? Then we have this dark band at the outer edge of the eye. So this client mentioned skin problems, and that was one of her main concerns. The skin is complicated. It represents so many things emotionally and is affected by so many imbalances in the body. I would delve deeper into asking her more questions about her skin symptoms, the types of problems, the frequency, the severity, the timing against her menstrual cycle, her stress levels. I would probably ask about emotion because skin is about defense, it's about being vulnerable, things like that, and there may be something there that might be complicating the issue. And then there's all of the information that the SClera provides as well. All of this is huge information, just huge, and there's more down here that we can't see and more up here. I didn't do SClera photos with this client. So while the irides show us genetic potential and the SClera provides information about what is going on in the body now. So I use the SClera to assess and recommend nutritional and lifestyle changes to address things that are current in the body. So we've got a two-part program, one part that is foundation, based on the eyes, one part that is very dynamic based on the SClera. So while the irides show constitution or how the person is put together, the SClera shows what is happening right now. The blood vessels in the SClera show us which part of the body is struggling under a toxic load, or is congested, or is inflamed. The SClera also shows us if a person is prone to allergies. So seeing specific scleral markings in the iris, like this squiggly blood vessel, the way this ties off a portion, this little pool vessel here, again, the thickness of these vessels, and this back here, this all tells us so much about what's happening right now. Iridology and sclerology do not give us a disease name. They tell us what questions to ask and where to look for related issues. So we don't have time to go into all of the details of what I specifically recommended for this client when I saw her many years ago, but I'm going to let you in on a secret. In September, I will be teaching a class that will integrate iridology, sclerology, nutrition, and herbology, all four of them. So if you know something about nutrition or something about herbology, you're going to get the rest of it. If you know herbology and nutrition but you don't have iridology, we're going to tie it all together. Back to this set of irides for just a moment. Based on her initial concerns, the questions I asked, and the answers she gave, and because I understand food, herbs, supplements, and lifestyle, my recommendations for our first appointment were to focus on her liver, using liver herbs and liver supporting foods, and her stomach using digestive enzymes and cutting out coffee. And I kept it just that simple. At her next appointment, after I learned how the past month had gone with the dietary changes and supplements, I asked how now that she was feeling better, if she had become aware of any new symptoms. I looked at her previous list of concerns because I had that prioritized list. I saw how they had improved and went to the next symptom that was down on the list and added in a little bit to help her with that. We kept that process up once a month for 6 months until we had her feeling like she was just doing beautifully. She doesn't come in every month anymore, hasn't for a long time. Now I see her about once or twice a year to do maintenance work, and that's lovely to have the repeat business. So when you understand the iris and the sclera, you can integrate your nutrition knowledge, you can integrate your herbal knowledge, and you can integrate your lifestyle knowledge and create an extremely powerful program for your clients, all in the time that you are with your client. So can you see how incorporating iridology, nutrition, herbology, and lifestyle into the assessment and recommendation process can help you to eliminate lengthy intake forms? The intake is a conversation instead of paperwork. It can help you to know exactly where to start in your recommendations and the problems you need to start addressing right from the get-go. It can significantly reduce your time doing your research and program design outside of your client time. You already know your nutrition and or your herbology. You just need to know how to put it into a relevant format, and that's what this course is going to teach you. And you also will experience, when you know how to integrate all of these things, how to keep from overwhelming your clients with too much info, and how to encourage them to become long-term repeat clients to keep building their health one step at a time. So I am doing this kind of free 32-minute, sorry, it's been 32 minutes, iridology intro workshops every 2 weeks for the duration of the summer. And I do hope you'll join me for more of them. Be on the lookout for more information about the integrated iridology class that I will be starting in September. So be on the lookout for it. If you want to be notified of these classes that I'm doing every 2 weeks, just like this one, and notified of when the integrated constitutional iridology course is coming up, please go to iridology.education. That's my website. And there's a couple of ways. There's a nasty little pop-up box, I know we all hate those, to get your email address, and you get a gift back for that, of course. And that's one way to get on my mailing list for these things. And the other way is there's a little thing in the sidebar that says, you know, click here to get the world's best iridology chart, which I did not design, I will admit. I give full credit to Bill Cardona, but that also puts you on the mailing list so that you will be notified whenever we have a class coming up. Additionally, the very next class will be Tuesday, June 28th at 6 p.m. Mountain, and you can register also at iridology.education. Click on the courses link and you will see the tab especially for nutritionists and iridologists.